who is professor. She is a professor and honorary consultant at Swansea University Medical School. She is also the clinical director for publishing and engagement at the Royal College of Pathologists and education and training lead, Wales AMR Health Delivery Group. She is vice president of Medical Women's Federation, and she has many fellowships, including Royal College of Pathologists, Royal College of Physicians, Learned Society of Wales. And in fact, I have looked her up online, and she has great work that has been done in Wales and in the UK, and she is really a leader in the AMR and stewardship. So we look forward to hear from Professor Davies about the experience from Wales, the stewardship in Wales. The floor is yours. Thank you.
Well, hello everyone, and thank you very much for the kind introduction, and especially to the organisers for inviting me to present here today. It's a real privilege to be able to join you at such a wonderfully informative symposium. It's been really super. Now, let me try and share my slides. Have they come up now? How's that?
Yes, but could you please
Yes.
make it in a presentation mode?
Okay, to me that is in presentation mode. Has it come up for you yet?
Not yet.
You can resharing it. Just stop sharing it and then do again.
Just a second, I have to go to another screen, I think. Now. Right, I shall try again.
Still not the full screen. Do it in a presentation mode.
I don't know why it's not full screen, because on my screen it is full screen.
Okay, what you do is you just stop sharing the screen. Now you open your presentation and put it in a full screen mode. Don't share it now. Don't share the screen now. First, you open your presentation. Keep it in a full screen mode. Are you able to do that?
I'm not sure why we have this problem. Just a second.
You know, very often what we do is, rather than sharing the screening icon, clicking on that, there's this book icon left of that. That usually works for us. But let's see, maybe it's working now.
Yeah, put it on a presentation mode now.
It's still in presentation mode for you.
Yeah, but it's not at the full screen. Yeah, make it that.
Can you show the photo, Mr. Doshi? If you could just take a screenshot, tell Dr. Angharad which icon to click next time when she shows us that, because she's in that WhatsApp group.
Let me just see.
Angharad, will you just click on that book?
Yeah, just now you go down. Take your cursor to the down right hand side down.
No, I don't think. Wait a minute.
Don't worry, it'll be okay. Just take the cursor to the book. I mean, I believe in the book. I don't know what Mr. Nitish.
Yeah, that's not how mine is set up. Just a minute.
Okay, it's fine.
Or ma'am, shall I share her presentation? I have a presentation.
Yeah, I think
Nice
that will be a good.
presentation.
Angharad, what do you say? Is it okay if we run the presentation from our end?
You could do. The only thing is, because there's quite a lot. I don't understand why it's not sharing as it normally would. Let's just try
It does
it
that
one more.
sometimes. It always does that sometimes. Let's see now.
This is fine. Now what you do is you take the cursor on the right hand
Mr.
side
Nikki, take a
bottom.
photograph. No, take a photograph and show where she needs to click and share it in that WhatsApp group. Just take
Okay.
a photograph and
I've clicked the photograph. I'm going to the WhatsApp.
yeah, and just point which icon she needs to press. Yeah. So mark that icon.
Now, how's that?
Yes,
Does it
perfect.
come up now?
Perfect.
Okay, it was the setting that
This
the
is fine now.
laptop was
Yeah.
on. Right, great. So I'm sorry about that delay, everybody, and thanks for bearing with us. Right, as you've heard, I'm a clinical director at the Royal College of Pathologists, and I'm a previous vice president of that college. By background, I'm a consultant microbiologist, and I have a special interest in education in the field of antimicrobial stewardship. And amongst other roles, I lead the education and training work stream of the Antimicrobial Resistance Human Health Delivery Group for Wales, which I'll talk about a bit later. And I've been a council member of the UK Academy of Medical Educators. So we're going to have a change of tack now, because my presentation, as you might have guessed, will have an educational theme and quite a different emphasis from your previous very expert speakers. So I hope that this will complement those talks and still be of interest. So this is what I plan to cover in the next 20 minutes or so. I know that with this audience, I don't need to spend time elaborating on why antimicrobial stewardship is such a critically important element of our practice. I know that you're all more than familiar with that. As well as diagnostics and therapeutics, which we've heard about today very wonderfully, another important part of our job is to educate other healthcare workers to use antibiotics responsibly. But are we doing this important job well enough? So I'm going to review the policy landscape for AMS education and how we can seek to measure the impact of our activities, and then explore the evidence that exists for the most effective ways to train our students and staff as we ought to, look at the published evidence on best practice in continuing CPD for healthcare workers, and finally I'll move on to share our experience in a case study of how we applied these principles in our setting. So I'm sure you're all familiar with the World Health Organization Global Action Plan on AMR. It's a few years old now, but the main pillars still apply. I've listed them here. And one of these pillars is education and training. As well as this, of course, we all have our own country action plans. The UK, for example, has a 20-year action plan. We're now in the second 5-year segment of that 20-year plan. So last year, in 2024, our second 5-year national action plan was published, which runs until 2029. Now, in this action plan, there are 4 main themes, which are shown on this slide. The theme that I'm interested in is the one in the top right of this slide in the orange. Within optimising the use of antimicrobials, we have health and social care training. And this is represented in the UK 5-year action plan in commitment 5.1. Which for the first time says it will be required for all of health and care workers and students to complete appropriate AMS training. And this is a great step forward for us because we haven't previously had that spelt out as a requirement as opposed to simply a recommendation. And you'll also see that we have a target associated with this, target 2A, which is that it says that we aim to increase healthcare and social care worker knowledge on AMR by 10% by 2019. And this quantified target is also a new element. Which begs the question of how do we measure a 10% improvement in healthcare worker knowledge on AMR? Well, this is how it's proposed that we'll do this. It's going to be done using European Centres for Disease Control survey, which was last carried out across Europe in 2019. In lots of countries across Europe, and you can, if you're interested, you can read all the results of that online. But this survey consists of 7 very, very basic questions. This is for all healthcare workers, not only specialists working in antimicrobial stewardship. And in 2019, 59% of UK healthcare workers were able to answer all 7 of these questions correctly. So a 10% improvement would require around 65% of healthcare workers to be able to answer them all correctly. And that is how this is going to be measured, by rerunning this survey. So how are we addressing this in Wales, where I work? So Wales, for any of you who may not be familiar with it, is one of the 4 nations of the UK. It's in the west of the UK, to the west of England. It's coloured red on this map. It is, of course, the most beautiful part of the UK, and it offers you a very warm welcome, and I highly recommend a visit. All 4 nations of the UK have devolved health services, and this document here is Wales's response to tackling AMR, published back a few years ago now. It was called Together for Health, and it included actions for Wales specifically. And in the Together for Health document, they committed to employing antimicrobial pharmacists in all the National Health Service organisations in Wales to support antimicrobial stewardship in a specialist role. Now, at that time, antimicrobial pharmacists were quite a new concept. People weren't very familiar with them. There were hardly any of them existing in Wales. Since that time, they have become an extremely important element in antimicrobial stewardship in the UK, and I know in other parts of the world as well. Along with the microbiologists, they are the key practitioners involved. However, for a pharmacist looking at taking up such a role, there are some very demanding asks, and I've listed here some of the elements from their health service job descriptions. You can see that these include to influence medical consultants on the management of pharmaceutically complex cases, to challenge treatment choices, to deputise for microbiology consultants, and to interpret microbiology results to provide clinically appropriate advice. So really, I'm sure you'll agree that these are quite challenging requirements. And so it's perhaps not surprising that when this document was published, the new cohort of antimicrobial pharmacists who were being appointed, new to these roles, approached me to say, help, we know about drugs and antibiotics, but we really have almost no knowledge of clinical microbiology. Can you help us by providing some training? So I did want to help, and this led me to explore a bit more the research underpinning continuing professional development of healthcare professionals. And in fact, if you're interested in this topic, the UK General Dental Council carried out an excellent and comprehensive review of the evidence on this topic. It's well worth a read if you're interested. And the literature shows that there are a number of principles for best practice for effective CPD for adult professional learners. And I've summarised the main findings here. One important aspect of good practice is relating the CPD course to the participants' learning needs. If it's relevant to the practitioner's daily work, it's much more likely to motivate and result in practice improvements. Secondly, there needs to be a combination of learning approaches, which should be interactive, such as case-based discussions and practical exercises. Thirdly, interactivity and interprofessional and peer learning. So peer learning can take a number of forms, such as peer feedback, peer discussion groups, peer interaction. And it facilitates best practice and is especially valuable for lone practitioners, which these antimicrobial pharmacists, especially at the outset, often were on their own in their health boards. They were the only ones in their hospitals. And peer learning has been shown to be more likely to lead to positive changes in practice. And interprofessional education is particularly beneficial in terms of promoting collaboration and teamwork. And finally, sustained support after completion of the course is another best practice feature, which I'm going to talk about later on. And I like to summarise these 4 points as the 4 I's: interest, interactive, interprofessional, and iterative for the sustained support. Despite all this evidence base, which does exist, adherence to these principles is patchy at best. This review in the BMJ identified 32 healthcare professions for which CPD was a mandated requirement, but found that there was very limited use of effective evidence-based methods to underpin all of this CPD that was going on. So a lot of activity, not using the evidence-based. So for our programme in Wales, we wanted to try to do better. And so with this in mind, in consultation with our pharmacists, we created a bespoke course on antimicrobial use, resistance and stewardship. It's a week-long course, it's intensive, it's face-to-face, and it's interdisciplinary, and it's attracted not only pharmacists, but specialist nurses, doctors and other groups of staff as well. This photograph shows you our latest cohort who came along last year on this course, which has been running for 10 years now. We aim to employ the evidence base to incorporate as many of the best practice features as we can through using the 4 I's that I've described. So first of all, it's designed to explicitly meet the needs of these learners, which was achieved by planning the course content in consultation with those learners from the outset. Secondly, it's as interactive as possible and uses all these elements which I've listed here to facilitate that. For example, we have a gram staining practical, which the students particularly enjoy. They look at gram stains and they relate these to the patient's clinical condition, the differential diagnosis and potential therapies. And these healthcare workers don't normally see the inside of a lab, so this really helps to improve their understanding of the whole diagnostic process and why the gram stain is important and how we can use that to help us, as an example. In between sessions, we use various games to keep people engaged and as icebreakers and to add a bit of fun. For example, some antibiotic top trumps games that we devised. The top trumps were a great success, and the Microbiology Society actually kindly funded us to produce them professionally as game cards. Thirdly, we make as much use as possible of interprofessional and peer learning. So on our course, we have both learners and tutors from as wide a range of disciplines as possible. There is plenty of evidence to support the benefit of interprofessional learning in healthcare settings. There was a Cochrane review, it's a few years old now, but still relevant, which found that most studies in this field found positive outcomes on several counts, including patient satisfaction, error rates, and especially team working, and was received very positively by learners. And the feedback from our course shows that this is one of the most highly valued aspects. They love to hear from different healthcare professionals, different perspectives, different angles on the same topic, as well as very positive feedback about the peer learning aspect, which I've already alluded to. And lastly, point number 4, the iterative point. We wanted to ensure that once people had attended this course, they just didn't just go home and forget all about it. It was very clear that those who were attending this course were highly engaged. They were very dynamic practitioners in their own health boards, and they were the ones providing training to all the health board staff locally in their hospitals in antimicrobial stewardship. And we wanted to find ways to harness this engagement and enthusiasm that they had to strengthen antimicrobial stewardship education across the whole of NHS Wales. And that's what led to the creation of AWARE, standing for All Wales Antimicrobial Resistance Educators. The idea was that we wanted to create a virtual, interprofessional, Wales-wide community of practice to share good practice, ideas, resources between our members. And by engaging this community, we could also build up a comprehensive picture of what training in antimicrobial stewardship was being provided in local areas across Wales and identify gaps. So we do that by using a website to share information and resources. It's at www.antibioticaware.com. It's freely available to anyone. There's no paywall or anything like that. And on this website, we store all of our shared resources, which are made freely available to educators, but also to medical students and others who want to use them. So these are just some examples of the resources on our website. We also have links to outside useful links, such as the UK Green Book for Immunisation, for example. We use an X account to communicate, for example, to promote the annual course. We've got a range of short animated videos covering basic topics for learners. That's called 1 Minute Micro, and a series of podcasts which have been created by our specialty trainees in microbiology. So it's been a great opportunity to support their learning as well. And so far, our trainees have been unstoppable. They've created nearly 60 episodes of this podcast on nearly every topic in infection that you can think of. They're really great, and they're available there freely to anyone on the website. So every year, we contact all the network members and ask them to provide us with information on the education they've delivered locally in their hospitals on AMS. And we use this to build up a picture of local provision, which we wouldn't otherwise capture. I've picked out this snapshot of data over the last few years, which shows that even despite the pandemic over 2020 and towards 2022, that period, our educators were able to reach more people for training than previously because of the rapid adoption of virtual platforms, making it easier for staff dispersed over rural areas to attend. And we were able to publish these findings in the Journal of Interprofessional Care. We've run various webinars showcasing members' educational practice, and we've branched out internationally. That started with a collaboration with the Royal College of Pathologists and the National Postgraduate Medical College of Nigeria. We ran a lecture series with them, which are available on the RC Path website. Those are freely available to anyone who would like to access them. And this year, we ran a global antimicrobial resistance webinar series with RC Path, with invited expert speakers from all over the world. Here are some of our expert speakers in a collage. And again, all of those webinars are freely available on the RC Path website. And we were here's a poster showing some of the details of this project, and on the left here you can see the wide range of countries that our expert speakers came from. And we were very proud that this project was shortlisted for the UK HSA Antibiotic Guardian Award for a multi-country collaboration. This shows the team and myself at the awards ceremony in Birmingham in the UK. So overall, the benefits of this project have been using best practice in CPD to do an evidence-based approach for CPD for all our healthcare workers in Wales. We are able to cascade the knowledge that we teach our specialist practitioners annually in our in-person course to all healthcare workers in Wales, because they are the ones going out to the hospitals and doing this work locally. Practitioners can engage with the network, and this supports their own educational work, helps them to share good practice, and it enables us to capture educational activity. And this has been really useful actually in informing the Wales Antimicrobial Resistance Human Health Delivery Group, which I'll talk a little bit more about to finish. And lastly, on this point, I'd like to point out that the AWARE project started as an entirely grassroots initiative without a penny of funding. All of the original activities, the resources and the original provision were set up at no cost whatsoever, just personal time and commitment. And I know that Dr. Rizvi has her initiative DASH to protect antibiotics, which is also a labour of love and shows what projects can achieve with enough personal commitment. And I'd like to congratulate her and everyone else in that team involved on that fantastic project. So returning to our National Action Plan, where are we now with antimicrobial stewardship education in Wales? Well, we now have a Welsh Government-led AMR Human Health Delivery Group, which has an education and training work stream, which I lead. This work stream is charged with ensuring provision of training for all healthcare and social care staff in Wales. This is our sort of the map of what we're trying to achieve. We have 3 levels. We have the very basic level. We have the prescribers and pharmacists and also nursing staff and non-prescribing healthcare practitioners at level 2, so sort of medium level of expertise. And then we have our specialist expert antimicrobial pharmacists and so forth at level 3. So we have now expanded our work, and so far we've already established and put in place the boxes that I'm ticking off in yellow. So we have our course, which I've already described to you. That's our specialist level provision. We have a very comprehensive and quite detailed e-learning module for our prescribers and pharmacists in both the community and primary care and in secondary care. And I'm pleased to say that we have now, thanks to the wording of the UK National Action Plan, which requires all health and social care workers to be appropriately trained, we have secured an agreement that our level 1 training will be mandated for all staff. That was a big step forward. And our next milestone will be our level 2 training for non-prescribers, including nursing staff. These are some of the challenges that we faced. In particular, we had a challenge around the mandation of training. So in Wales, infection prevention and control training is mandated. AMS training was not. That meant that we were aware that even if we had in place good basic training for health or for all healthcare workers, it would be difficult to ensure that people actually undertook that training. So it actually helped us enormously when the National Action Plan came out saying that that training was from now on going to be required. So this is a reminder that the precise wording of documents such as action plans can help enormously. So if you have the opportunity to input into such documents, do try to use your influence to make them as firm as possible. And I've listed a few of the other types of challenges that we've encountered as well. Some of those to do with budgets, some of them to do with different stakeholders having different priorities, and some of them to do with sometimes the disconnect between different organisations. The last challenge there about diverse professions, I've included that. But actually, I see that as a strength. As I've said, we place great emphasis on interprofessional learning, and we think that bringing the different professions together actually strengthens the training. So that's just a reminder about our National Action Plan requirement and how helpful that has been. That has really moved our project forward. So that brings me to the end of my presentation. Here's a summary of some of the resources that I've talked about. They're all free to access online to anyone who would like to do so. So if you think you'd find some of those useful, do go and explore some of those. And thank you so much for the invitation to join you today. It's been an absolute privilege and a pleasure to